Today I'm covering the 5 things about C-sections that maybe you haven't heard about. So if you're having a C-section or you know someone who is, I want you to stay tuned and get ready to learn. Welcome back, everybody. Dr. Jennifer Lincoln, board-certified OBGYN, and today I'm busting myths about C-sections, which is important considering that about 1/3 of babies born in the United States are born this way. As always, references and resources in the show notes, and before I get started, hit the subscribe and turn on the bell so that way you can get more content like this if you're into it. If not, don't do it. Let's get started. First tip. Partners or support people may feel like they've been forgotten while you're in the operating room getting prepped and ready for your C-section. What I mean by that is that we very often don't bring partners in until we're just about to start. And that's because we're doing a lot of things while we're getting you ready for the birth of your baby. We're getting anesthesia medicine placed, which is usually an epidural or spinal medicine in the back. We're laying you down, getting you correctly positioned, making sure that anesthesia is working correctly, making sure your baby's heart rate is good, doing all of our checks, getting your belly cleaned and prepped, getting all of the sterile equipment in place. And that's a lot of moving parts. And so having an extra person in the operating room who is not a medical provider and doesn't know where to go or where to stand, it's just easier sometimes to not bring them in until all of that is settled, and we can have you sitting right there at the head of where you are to support you when everything's ready to go. And in truth, it only takes about, I don't know, maybe 5 or 10 minutes, sometimes a little bit longer. But so often I've seen partners who said, I thought you forgot about me out there and I thought you started the delivery without me. And so that's always part of my spiel where I say, you're going to think we forgot you out here, but I promise we will get you in and we will not start without you. Okay, second thing about having C-sections, and I think this is super important, you will not be completely numb. And I have found that if you don't know that ahead of time, that can be really anxiety provoking. So when we use spinal or epidural medicine to act as the pain control for a C-section, what we're doing is we're blocking the pain, which obviously is like the most important part. What it won't block is the feeling or the sensation of movement and pressure. And that pressure can feel intense, especially when we are at the part where we're delivering your baby. And the reason that is that the nerves that transmit those sensations are different than the ones that transmit pain. And so I have had people before who have been completely freaked out that they could feel things. And I feel that at least knowing that that's normal ahead of time and that's not a sign that your spinal has failed can help you understand that you're good, you're okay, it's going to be okay. Okay, tip 3, you will likely meet your baby quicker than you think. And so on average, from the start of the C-section, so when we make that first incision, to the time of the delivery of your baby, it can be anywhere from under a minute if it's an emergency to a couple of minutes. It's not long. That part of the surgery and the delivery is the shortest part. Now that changes if you've had many C-sections before, or even just one C-section or another surgery and you've got lots of scar tissue and we're having to go more slowly, and that's okay. But usually I find parents are so shocked at how quickly baby is delivered. And then the remainder of the surgery takes much longer and is important, as you can imagine, because we want things to be, put together and put back how they were, and that takes some time. But the good news is that you'll get your baby in your arms sooner than you think. Tip 4, you can ask to watch your whole delivery if you want in most hospitals. So what I mean by that is that in most places we have drapes, and we have a drape between your head and where we're operating for sterility so that germs can't cross. But in a lot of them, like in the hospital I work, we can drop that down and just have a clear drape so you can see when your baby's being born. Now, a lot of people will choose just to have that drop just so they can see their baby and we hold up their baby while we're doing delayed cord clamping. But if you're into it and you want to watch the whole thing, be my guest, let us know and you can watch the whole thing. I mean, I think it's pretty cool. And if you want us to place a mirror so that you can see the whole thing, again, it's totally your choice. Now, if that sounds disgusting and gross, it's okay. I think it's really cool. But if you want to, you can ask. Okay, last insider tip here on C-sections, and this one kind of sucks. You might throw up. And in fact, a lot of people do during C-sections. And it has to do with the numbing medicine combined with all of the hormones that are happening at the time of delivery, the hormone shifts, the shifts of blood volume, that kind of thing. Sometimes you can get a bit nauseated and throw up. Just let us know. You've got your anesthesiologist right there who can help you with a little thing that you can throw up into. We can help you swish and clean up your mouth, make sure you're all beautiful and awesome and looking amazing for when you get to meet your baby and for all those photo ops. But do know, if you're feeling nauseous, let us know. We've got medicines that we can give you, and not just one, we've got a bunch of different stuff we can try. So let us know if you're not feeling so hot and if you do throw up. I'm so sorry. I promise it won't last forever. All right, those are my 5 quick tips about having a C-section. Drop yours in the comments. Let me know which tip I didn't cover, or which tip you are really surprised to hear about, or what you wish you had known before your C-section. I hope this helps those parents out there who are birthing by C-section or who are supporting those who are birthing by C-section.